I don't know how many of you know me, but I did used to be a dental hygienist. I then went back to school and became a naturopath, and then I became a doctor of integrative medicine. I still am very, very involved with the dental world, and so I'm going to try to teach you things so that we'll elevate hygienists, and you're going to see what my goal is at the very, very end. There are 3 different ways that you can get labs drawn with absolutely no physician orders. You just have to know what to order. One of the ways is through directlabs.com. And when I use them, I ask a patient to get a wellness panel with a D3 added. There's another way, and don't worry about taking notes. This is all written down for you.
Okay.
Through Anytime Labs, and there are multiple locations. The only place that has a problem is New York. New York won't let labs be drawn, so people have to go outside of New York in order to get labs drawn without a doctor's orders. If you're in Texas, yeehaw, that's where I am, then it's very easy. There's a place called Majestic Wellness, and I have given you Letitia's website and her phone number, and she will coordinate getting labs drawn anywhere in Texas. And then I usually ask for a health profile with a D3 added. I then actually gave you my consent form that I created for people that are using Majestic Wellness so that they can see what kind of labs they're getting on there. Now, let me explain the value of this. The health profile, which is what I usually ask for, is 51 different things that they're getting checked. It's an $800 panel that they will pay $80 for. Cannot beat that with a stick. And then if they need something extra, they can get extra things added on there. I also put on here a form that I designed for a dentist many years ago, because I think it's important that when a new patient comes into your office, you guys immediately are connected with a physician or a naturopath, depending on which state you're in, someone who's going to accept responsibility for that patient, who is going to let you know that their platelet count is too low and they're not a good candidate for surgery. Let you know that they are in the process of getting their bilirubin down, so they're not a good candidate for amalgam removal. You put the monkey back on that doctor's, back on his back, so that if the patient gets sick after amalgam removal, it's not your process because you followed a completely safe protocol. The person wasn't ready for mercury removal yet. So networking with a healthcare provider becomes one of your foremost goals. And as a hygienist, you need to get your name known as, wow, I keep getting letters from this dental hygienist asking me if my patient has this, or can I rule that out, so that they understand that you're an educated individual and that they can communicate back with you. Plus, you might get referrals from some of these other practitioners. If all of a sudden you're referring to a cardiologist, then he's more likely to send his patients to your office because he understands that you're going to be looking out for their heart health. All labs that you get drawn should be fasting unless I tell a patient otherwise. There are a few things that don't require fasting. For instance, a thyroid does not require fasting. A D3, an iron level, a hemoglobin A1C can be done any time of day. Doesn't matter whether you just ate or not. But other than that, if they get labs drawn and they've eaten, it's going to throw too many of them off. It's not just the glucose it throws off. It's a lot of other things. I wish you could see this, so I'm going to ask you to write this down. If you've got a piece of paper in front of you, this is helpful. The first set of numbers I want you to write down is 60 to 270. So it's just 60-270. Under that, write 135 to 225. And then I want you to write 313 to 618. Okay, the reason that I want you to know that is because if I had your labs drawn and in one building there were 10 different laboratories, and I drew the blood and I gave the blood to 10 different laboratories, they should all come up with the same value or within a point or two. So let's say 118. is what your actual number is. And all 10 labs agree it's 118. Does 118 fit within the parameters of all three of those sets of ranges that I gave you? No, it doesn't. Every lab has their own set of ranges, and it is dependent on the people who came through that lab. The reason I'm showing you this is the very last set of numbers that I gave you is from MD Anderson. That's our cancer clinic. Who gets labs drawn at a cancer clinic? Usually people who have cancer. And if an LDH is elevated, it is a marker that the cancer has metastasized into the bone. And so if they've got people that have values of, like I'm on my screen here, the last value I have is 2067. That's somebody whose cancer has metastasized to the bone. It's going to skew the ranges. Hopefully y'all are shaking your head and you understand, because I can't see you. It's really important because all of a sudden we're depending on the piece of paper that comes back having an H or an L by it, and that's not necessarily so. My point in telling you this is there are physicians and naturopaths that use functional sets of numbers, which means that our range is dependent on taking a group of people that are healthy and looking at what their numbers are and saying, okay, now the average is this, and the standard deviation on either side gives us this set of ranges, which is completely different than what you've been used to. Let's go to a hemoglobin A1C. This is a test that can be done in a dental office. I usually have patients go to CVS because or Walgreens, they can pick up a kit for about $41. It's got 2 test kits in there. If you go online, you're going to get it for a lot less, because you're going to get a test kit that has maybe 20 in it, and you'd be doing it for maybe $8 a test. It's not a fasting test. You do have to prick the finger. You can have the patient do it themselves. There's a little gadget that I use that you push down on the finger and they push the button, and then it plops the needle into the finger. It doesn't hurt. I like to use the side of the hand instead of the end of a finger if they're real sensitive there. It doesn't really matter where you use it. Then there's a little strip that goes in there, and it takes about 5 minutes to get your results. If your results are 5.6 or less, you're good to go. If they're higher than that, then you want to continue to monitor it. Refer them out to their practitioner. You will be shocked to find that maybe a new patient coming in that has some broken teeth or has a couple of root canals that are reinfected, and they don't even know that their hemoglobin A1C is 11 or 12, and they haven't even been diagnosed as a diabetic because they haven't been to a doctor in forever. Then you get their mouth cleaned up and their hemoglobin A1C drops below that 5.6. Everyone's heard of gestational diabetes. That means that when you're pregnant, your body is too big and can't function properly, and therefore your blood sugar goes up and you mimic diabetes. So we call it gestational diabetes. We also have overweight diabetes. Well, there should be a dental diabetes. When there's a gross infection, it can make the blood sugar go higher. Now, hemoglobin A1C is looking at, and I wish you could see me because I'm using my hands right now and you can't because you're looking at my screen. If you drew a circle and then you put little spikes on the outside of the circle, those would be the sugar coated on the outside of the red blood cell. That is actually what you're looking at when you're doing the test of a hemoglobin A1C, is the excess sugar that's coated on the outside of a red blood cell over a 120-day period. So it's an average. Super cool if you are getting to sit in on autopsies, which at two of my schools that I've gone to, we had to do not only cadaver labs, but go and spend time at the morgue and sit in on autopsies. Really cool when they start opening up arteries and you see the scratches down the sides of the arteries that happen from the excess sugar on the outside of that red blood cell. And that is part of the reason why diabetics end up losing their vision, having kidney dysfunction, and losing their feet because of all those scratches. So there's not an advantage to having elevated blood sugar. And in a dental office could be a great place where you're finding this for the first time. I cannot tell you how many times I have found somebody is elevated and it's the first time that I can't be diabetic. There's no way. Yeah, trust me. I'm going to send you someplace else for a secondary confirmation. Diabetic appointment should be early in the morning, and your question should be to them, what was your last hemoglobin A1C, and then document it. We had a staff member years ago whose name was Tony, and she was diabetic, and we knew to just pay special attention to her. One morning I walked in and she was cleaning an operatory and her hand just kept going round and round and round on the countertop. I said, Tony, are you okay? And she looked at me with a really dazed look. And I said, did you take your insulin this morning? And she just kind of stood there. And I said, did you eat? And she didn't. So I had to go get her some orange juice. It's just those little things that you're looking at. You do want to have some form of glucose or orange juice handy. You don't really want to have candy, but glucose comes in a squirt tube. You can use that. Insulin resistance is also called metabolic syndrome, and you'll hear the term syndrome X. I don't know why they can't pick a name, but insulin resistance is pre-diabetes. Oftentimes they'll have high blood pressure, or they'll be on a prescription for hypertension, and actually the insulin resistance could be the cause. So if you can refer them out to a practitioner who is keen on looking for that, then they may be able to come off of their prescription medication once they get their insulin resistance dealt with. If they have one or more of the following: a fasting blood glucose that's over 100, or an oral glucose tolerance test where at the hour mark it's over 125 or over 120 at the 2-hour mark, or they have triglycerides that are over 150, or they have a really low good cholesterol. And the difference between HDL, which think of heaven, that's a good place, and the LDL is someplace you would not want to go. That's the bad cholesterol. That'll help you remember that. If they have a fasting insulin that's too high, or you look at the liver enzymes and they have an elevated ALT or a GGTP that's too high, or an elevated C-reactive protein, high fibrinogen, low vitamin D, they might be on a statin. A good marker is waist size. If it's larger than 40 in a man or over 35 in a woman, that puts them at higher risk of diabetes. Or a history of polycystic ovary syndrome, gestational diabetes, preeclampsia, or they have an elevated uric acid, or they have idiopathic peripheral neuropathy, which means there's no cause for their numbness and tingling in their extremities, or they have periodontal disease, which is why we come into the picture. There isn't anything that I can't bring back to dentistry. So if you think of it that way, you will keep yourself safe and you are practicing within your scope. And then the last two things are sleep disorders and erectile dysfunction. All of those are red flags for sugar issues. Now, another thing that would be super important for you to pay attention to, and I realize that hygienists don't write prescriptions, but it's important that you help keep your dentist safe. There's an old adage: when I worked as a paramedic, oftentimes you didn't get to work with another paramedic, you were working with an EMT. And one of my EMTs drove up and their bumper sticker said, EMTs save paramedics' lives, which is actually true. Oftentimes you get in the moment and you forget to do something, and it would be your partner that say, don't you need to do this and such first? Oh yeah, oh yeah. How many dentist offices have you worked in where they've called in a prescription and they didn't really understand what the prescription was, or they didn't know everything about it? So I'm just trying to point out things for you so that you will pay attention and be able to discuss things with your patient. So here's the thing that happens very often. Ask to look at people's blood work. Have them come in and just, glance at a couple of things. Tell them you're just looking at 1 or 2 items. That's fine. But do pay attention to all of the paperwork. Their glomerular function rate is looking at the kidney function. And the magic number is 60. If it's less than 60, then they're already in stage 2 renal failure. And that is where most people sit. It's shocking. And they've never been told that they have a compromised kidney. If your patient starts to get close to 70, in EMS, which is of course the emergency medical services, they teach paramedics that if the patient is over 70, you have to reduce the strength of anything that you're giving to that individual, knowing that it's going to hang in the tissues longer and it's not really going to get to where it needs to be without you building up a toxic level of it, because the kidneys don't function as well. A good example is my mom had an injury to her hand this last year. Didn't say anything to me. I don't know why. Went to an emergency clinic and they gave her a prescription for an antibiotic. My mom is 87. All of a sudden she got really sick and then she called me. And of course I know what she's on. And I said, oh, there isn't anything that you're on that should do this. And she said, oh yeah, I didn't tell you the other day. I went to the emergency clinic and they gave me a prescription of an antibiotic because I had this infection in my hand. The cat scratched me. And I said, well, what dose did they give you? And it was a dose that would be given to somebody who was in their 40s. And she's in stage 3 renal failure. She's not quite at a point where she needs dialysis, but she really has a struggling kidney. So I want you to pay attention to this, because you're going to be shocked. Many of you are going to look at your labs and go, holy crap, I'm already in renal failure. All right, let's look at the next thing. That is uric acid. The reason that I put this one in here is there's a very popular diet right now called a keto. And so if you're eating keto and your uric acid goes up, you're going to end up with gout. Now, uric acid can also go up because of elevated sugar levels, so that wouldn't be so unusual. It can go up because of heavy metals. It can go up because you're got some kind of infection, which is driving your sugar level up. It can go up because you just took aspirin and I have an artificial number. There are many, many reasons why it can be low, and easily we can bring it up. We need the uric acid to be at a certain level, or we're not able to conjugate heavy metals to make them less toxic. For instance, you can't get mercury out. This is the test that most physicians look at for gout. And if gout is when you build up these crystals, they usually build up in joints. So you'll have a thumb or an elbow or a knee or a large toe that will really start to swell and cause you problems. If you ever get gout, you will take allopurinol or anything in order to prevent getting it again, because it's quite painful. But normally, if you just curtail your protein intake, take a digestive enzyme, and look at the amount of alcohol that you're drinking, you can prevent it from going up again. The LDHs is what we were talking about earlier. That was the lab that I used to show you the difference in the ranges of different labs. That is usually present in heart and skeletal muscles and the red blood cells to a smaller amount, and in lung and lymphoid and liver and kidney. Is a very good indicator of how someone is either aerobic or anaerobic in their metabolism. It also tells me a few things about digestion. If it's really low, then I might be thinking about low blood sugars. If it's really low, I might be thinking about mercury toxicity. If it's really high, then I'm looking at the possibility of bone cancer or some kind of infection, or possibly anemia, maybe even diabetes. D3, super important, but there's some things we need to know about D3. I like the level to be somewhere between 60 and 80. I'm going to tell you that honestly, the chair side tests stink. If you do a chair side test and you ask the person to have it done in the lab, you're going to see it doesn't correlate. And therefore, I've kind of thrown the chair side tests out the window, and I just asked them to get it done through the lab. It's actually a hormone. It was once thought to be a simple hormone involved only in bone and calcium metabolism, and now we know it's way more complex than that. It also functions in our immune system and with inflammation, which is important for us in dentistry. It's also associated with aging and elevated blood sugars, poor neurological health. If someone comes in and tells me that they're depressed, one of the first things I want to do is not put them on an antidepressant. I want to look at what their D level is, and I can get those results back in 24 hours and know whether they're low in D, and then start working on that. As we're looking at the following page, you will see all the different things that play into a low vitamin D. And now you see it's not just bone health. You'll see what the depression in the second line there. It's also well documented that it's an issue with breast cancer. It's a big issue with colon cancer. So if I can keep someone's vitamin D level between 60 and 80, I'm going to reduce their risk of getting COVID. I'm going to reduce their risk of respiratory infections, of different types of cancer, of different depressions. So there isn't an advantage to it being low. Here's a good thing to know. You can't just give D and get their D up, because D without A doesn't function correctly, and vice versa, A without D doesn't function correctly. If you're a follower of Weston Price, you know this. If you're not, then I'm going to bring this to your attention. There is a cod liver oil called Rosarita extra virgin cod liver oil, but there are other Weston Price, I guess, ones that they say are good to use. The A in the cod liver oil, first off, it's from a cod fish. It's not fish oils. It's from the liver, and they put these livers in a barrel and extract the oil out of it. It's too gross to even think about, because then you won't want to take it. But it's rich in vitamin A, and that A is converted into first retinol and later into retinoic acid. The D is converted first into calcidiol and later into the calcitrol. The enzymes that are involved in both those conversions are what produce the hormones. And then there's research recently that shows that the vitamin D can only effectively activate target genes, which is the VDR, when its partner receptor is activated by vitamin A. And in the absence of A, it binds to the receptors, preventing D from functioning. And I put that resource in there for you. Another thing that is big in some dental offices is suggesting that patients go get a high-dose vitamin C IV drip, or they might even offer that in the office, which I'm going to stop right there and make, I'm going to tell you that you can take a phlebotomy course and learn how to do venipuncture if you're helping in the office, or like doing PRF, but a dentist does not have a duty to delegate. Therefore, you must have a medical coordinator or a medical director over your dental clinic, and then you would be working under that physician's license. And if any of you do that, you can ask me at the end and I'll go over that again, so that I want to keep you hygienists safe as well. But a G6PD is what protects the red blood cells from oxidation. And people who are really low in it or don't have any, which are in particular ethnic groups like Indians, particularly like American Indians, then when they get an IV of vitamin C, their cells explode. Not a good thing. There is a lingual ascorbic acid test. I don't know if anybody's ever done that before. I used to do it years ago. We would mix up the endophenol, which you get it as a dichloroendophenol, a little tablet, and you mix it with water and it becomes a little blue solution that's not good but for a day or two, and then you have to mix up a new batch. But you put it on the tongue and it will show you if there are enough vitamin C has made it to the oral cavity. Now, when you look at the research, they're going to tell you what I just told you about vitamin D. The chairside vitamin D test doesn't correspond with what we see in the lab. And that's what happens when they tried to correlate the lingual ascorbic acid test with measuring amounts that are in the body by blood. It's not the same, but that's true, because what we want to know is how much of the vitamin C actually made it to the oral cavity. That's what we're testing. This is not a test to tell you how much vitamin C you have in your entire body. So if you use it in that context, then you will be telling the truth. If you're telling the patient this is how much vitamin C they have in their body, that's not true. And the way you do it is you have the patient rinse their mouth out, you grab the end of their tongue with a little gauze pad, and then you dry the area that you want to use, and then you stroke the papilla so that they can stand up straight, and then you put a drop of this little blue stuff that I told you about on that area, and then you start your stopwatch to see how quickly it goes away. It should go away very quickly. If it's 15 seconds or less, that's good. If it takes longer than that, then we haven't gotten enough vitamin C to the oral cavity. And I gave you a resource down there as well. Now, a C-reactive protein. There are two different C-reactive proteins. The regular C-reactive proteins, ideal would be less than 8. But C-reactive protein shows all inflammation. So for instance, mine was stupid crazy high, like at 55, before I had my hips replaced. Why? Because I had so much inflammation in my hips. So it wasn't a very good marker if I knew that that was my problem. If your patient comes in and they have a gut issue, then it's going to go up because they've got inflammation in the gut. So I don't really want to use this as any kind of a marker for perio. Here's another CRP, but it's called the high sensitivity CRP. We don't want it higher than 1. There's a big difference. And this is what Bale and Doneen will call a marker, not a player, in looking at your cardiovascular diseases. Elevated levels are associated with a higher risk for cardiovascular disease, heart attack, and stroke. And I told you that it's good if it's less than 1. 1 to 3 is moderate, and if it's over 3, that's not good at all. You can do an oral zinc test. I love to do this test because I love to see the expressions on people's faces when you do it. Zinc is involved in all kinds of tissue repair and also with the replication of our DNA and RNA. A low level can change all kinds of things, not just your immune system. It can change all kinds of other things. A low level inhibits you from being able to make your own hydrochloric acid. If you don't have enough hydrochloric acid, you won't be able to absorb B12 out of the red meat that you eat, and you won't be able to break down the protein. So the most downstream root issue is the zinc. It also interferes with your ability to taste or smell. So if somebody comes in, well, nowadays, if they say they can't smell anything, you think COVID, but it could be that they're low in zinc. So again, the oral zinc status can be different than what the serum level is. We want to know how much makes it to the mouth. It's a cool test to do. What you do is get this solution of zinc sulfate. I get mine from Apex Energetics, comes in a little bottle. I just pour a small amount, like maybe a capful in a cup, ask them to throw it in the back of their mouth, swish it once, and then swallow, and ask if they noticed a taste. If they didn't notice the taste at all, then they're completely zinc deficient. If a couple of seconds go by and they go, yeah, I taste something, okay, that's a weak response. Ideal would be that they put it in their mouth, they swish it, and they spit it out. They go, no, I'm not swallowing that. That is absolutely gross. It is a very, very strong negative reaction. And then you know that they have adequate levels of zinc. Zinc is a natural antibiotic by being incorporated into its special peptase digestive enzyme in mucous membranes. It also serves to dissolve the bacteria cell with proteins, which is what makes it the antibiotic. It is especially active in the prostate and in a man's urethra and urinary tract, which is why most of the supplements you see that have saw palmetto will also have zinc in it. Zinc has antioxidant properties. It also improves your nitrogen balance. It modulates activity of prostaglandins and blood levels of essential fatty acids. It's important in reproductive development and immune system development. Low zinc levels can retard growth. So you're looking at children and you see that they are undersized. Maybe they have low zinc. It's also extremely important for short-term memory. People, when they come in and they tell me they have short-term memory loss, I can't remember where I put my car keys. One of the things I'm looking at is their zinc level. It's required for release and transport of vitamin A from the liver. A zinc deficiency accounts in part for impaired vision characteristics in vitamin A deficient children. And zinc and its metabolites and its enzymes have been identified in at least 200 different things that they assist in, like carbohydrates, lipid and protein metabolism, nucleic acid synthesis. It takes zinc for tissue repair. There's so many things that zinc is dependent on that now you want to start giving zinc to everybody, but don't do that because you can overload the person on zinc. Zinc is a good chelator of iron. So if someone came in and they had hemochromatosis, which is a toxic level of iron, I would be giving them higher levels of zinc to bind to that iron and assist it out of the body. So you don't want to create an imbalance. But signs of zinc deficiency, where you could then write a letter to their primary care and say, these are some of the things that I see in my patient. Can you rule out a zinc deficiency? Which is what I want you to do. You'll see skin lesions, chronic inflammation. Oftentimes you'll see those cracks, which are the chelosis on the sides of the mouth. In men and women, it's common to see that they have an outbreak of herpes, which is directly related to the low zinc. If they have a history of herpetic lesions, if they'll keep their zinc level where it needs to be, they'll have fewer outbreaks. In men, the slightest deficiency can cause a prostate infection. In men and women, zinc deficiencies often are associated with hair loss, dry skin. So now we're thinking thyroid problems, but it really could be the zinc. The cracked sides of their mouth and white spots is a good thing for you to look at. So when you're taking your patient's blood pressure, you might just glance at their fingernails, and if they don't have paint on them, then you can see if they have those little white spots, because that's a true marker for a low zinc. Increased mercury in the body reduces the excretion of aluminum. Zinc supplementation will slow the accumulation of aluminum. Cadmium will lower zinc. So your patients that smoke end up with higher levels of cadmium, or they're around secondhand smoke, which means that it's going to reduce their zinc level. High intake of zinc can interfere with copper utilization, which will cause the incomplete iron metabolism, which is why I use it to bring the iron level down. When zinc is added to the diet, vitamin A needs to be added in higher quantities. And zinc is a pH-dependent mineral. So if your first morning urine pH is, let's say, 5.5, that means that you're acidic. Zinc is a pH-dependent mineral. It'll only work between 6.4, 6.8. So if you're not in that window, then the zinc isn't even going to go in. And many people that become acidic, that's why they start losing zinc and then therefore don't make enough hydrochloric acid. So there are ways to get around that by using different forms of zinc. I use one by Biotics called Z-enzyme. Another thing that a hygienist could look at that's not even a lab, but would give you a reason to refer a patient out, is looking at the earlobe crease. Of course, here we see President Bush, and you see the really strong crease that's there. We do see that there's a correlation with this earlobe crease and cardiovascular diseases. So simply, if they've not been to a doctor for quite some time, it would give you a reason to say, I'm going to request that the doctor runs some tests on you. Another thing you could look at would be their feet or their ankles. This top picture I put in there shows you what pitting edema is. And we rate that pitting edema by 1, 2, 3, or 4. And it's the number of seconds that it takes for those indentions to go away. And looks like that one would probably be a strong 4. But what happens with congestive heart failure is that the heart is actually too weak to be able to pump the blood properly. So the blood starts to pool in the feet. It can't get back to the heart, and that fluid starts to seep into surrounding tissues. Sometimes you'll even notice that you're listening to the patient and you hear fluid in their chest as they're breathing. You hear this rattling noise. And then we have a reason to send them to a cardiologist if we're doing some type of DNA testing and we see that there are specific bacteria. So you should have a very, very tight relationship with a couple of cardiologists near you. One of the tests you might be asking them to run is a myeloperoxidase. It's a white blood cell that is seen when there's a really high risk for heart attack. This is not seen very often. If it is seen high, it absolutely trumps everything, because it increases the risk of a heart attack and the person dying from this heart attack. It will be elevated before a cardiovascular event. So it's a very, very high marker that we see elevated. And when it's high and they have a plaque 2 elevated, they have got to do something immediately. So I put the plaque 2 on there as well. It's a blood test that if it's less than 180, it's good. If it's over 180, it's bad. It's looking at the lining of the tissue, and it is an early marker for atherosclerosis. It's the first test that was ever cleared by the FDA for determining someone's risk of a stroke with plaque involved. And then the LP plaque 2, it is again a disease that I'm sorry, it's a predictor of when someone's going to have a stroke. This is the only one that will increase due to periodontal disease. And so again, perio comes into play. We're looking at cardiovascular and perio, and we know all that ties in. You, and I mean, yes, you sitting right there, could be the one that saves a person's life. You're the one that sent them to go find out that they have diabetes. You're the one that sent them to a cardiologist and found out that their myeloperoxidase was elevated. Your office might be the one to refer them out, and nobody else has paid any attention to it. The thing that I wanted to stress, and I told you that was my goal in the beginning, you are not just a dental hygienist. If anybody comes up to me and says, oh, no, I'm just the dental hygienist, I am just going to go berserk. You are a dental hygiene practitioner. And for me, that means if you're talking to the nurse in an office versus a nurse practitioner, it means that you're elevated at a different level. And maybe I would be speaking to you using different words than I would be if you were the nurse, or if you were the medical assistant that was just taking the blood pressure. You are a dental hygiene practitioner, and you should treat yourself that way. And whenever you are in doubt, refer out. And so that is the end of my presentation. If we can figure out how to get me off of there and everybody opened up, then I will take questions.
Dawn, that was awesome. Thank you. That was fabulous.
I'm sad that I couldn't see people's faces or reactions, and you couldn't see my hands going around as I'm wheeling them around trying to, I'm not Italian, but I probably should be just because I use my hands so much. I didn't want to go over just regular labs. You guys, I've done, I taped something for KT seminars, and it's on regular labs. If you guys ever want to take that, I think there's CE available. If you just Google KT seminars, I think it's like $297, and it goes over the traditional labs that you would see, you know, the uric acid and what the ranges should be, if that is of interest to you. But I'm always available for stuff, so you can, you know, ask me specific questions. Just put in the tagline, you know, I'm a dental hygienist asking a question, and that way I won't dump your email thinking that you're some weirdo trying to send me a penile enlargement, because I get all kinds of weird ads. Is there anything that somebody has a question about from what I discussed?
Can I ask a question?
Sure.
When you have a patient complaining of a metal taste in their mouth, this in particular was after a COVID injection. The patient said about a day or two afterwards started developing really like a strong sense of a metal taste in his mouth, and it hadn't gone away. And normally we know that very often it's medications that cause a metal taste in the mouth. Would you have any sort of thoughts on what could be the cause of that, and what could one do to help the patient?
I would look at things like what their iron level is. I'd be curious about that. I'd also want to know about a zinc, so you might be able to do that. They don't have any dissimilar metals in their mouth, so it's not a galvanic reaction.
He does have a lot of dentistry in his mouth, so there could be, but it was very specifically related to
For the COVID. It's interesting. When the COVID injection first came out, the very first vaccine, we happened to be having a board meeting, and one of the doctors got on and said, as a naturopath, if you saw this, what would you think? And it was somebody who had had an extraction, and they came back 6 weeks post-op, and there's just a hole. And yet they used PRF, they sutured them. And I said, well, let me think about it for a minute, because the first thing I'm thinking about is clotting disorders. Then we had our board meeting, and at the end of the board meeting, one of the doctors said, Dawn, before you go, I have a question. I have a patient that I took a tooth out and it was complete. I mean, it didn't heal at all. And so the first doctor was still on the line. He said, oh my God, tell me about that, because I just asked her about that. And so we started this conversation, and all I could think of was clotting disorders. And then I said, wait a minute, you guys ask your patient if they had the COVID vaccine. The first person had theirs 3 weeks before, the second one was 3 days before. And we know now that many people have clotting reactions that develop after the COVID vaccination. We just don't know the trigger to it yet. So first off, I'd send them back to their primary care. And, you know, maybe look at the pH of their mouth and see if they could be having some difficulties there. That would be my first thought.
Okay. Thank you. Yeah, if anybody else doesn't want to ask a question, I'll come back later. I've got another one. So
I had a question, since we're kind of talking about COVID. What are some suggestions for patients who've kind of lost their sense of taste or smell, and it just hasn't really come back, or they still have a weird, every so often they'll just smell like cigarette smoke or something? Any suggestions?
Zinc. Look at the zinc. You know, my patients that I can't think, well, I can probably think of 2 patients of mine that have actually had the vaccination. I usually suggest that they go on Orthomune, and it's by Orthobiotics, and it's got vitamin D, and it's got vitamin C, and it's got quercetin and NAC and zinc in it. And you take 2 capsules a day. It's just an inexpensive, and by that I mean, I think I sell it for about $30 or something, and that's a 2-month supply. So that's pretty inexpensive to get all of those in that amount. But I hate to tell somebody to take it without knowing what their other levels are. So if I've already got somebody on 10,000 IUs of D a day, I don't want to give them 2,000 IUs more and send them over the edge. But just an all around, that's a good thing. If you keep your immune system in a good place, then you shouldn't have an issue. But those that took the vaccine, you know, maybe it's interfering with their zinc. That would be a good place to look, because it does have such an impact on loss of smell.
Can you repeat the name of that supplement?
Yeah, it's Orthomune. If you Google ORTHOMUNE, you should come
Thank
up
you.
with it. It's by Orthobiotics, great company.
Thank you.
Dr. Ewing, can you tell us what the ratio is of vitamin A to D and A to zinc that you recommended?
If you use the cod liver oil, nature has done that. You know, God does so many wonderful things for us that we don't even think about. You know, in order to get your omega-3s, you've got your fish up, you know, like salmon, and then you've got coconuts down in the tropics. We have everything we need in correct proportions. It's when we try to give D without A separately that we end up with a problem. So using those fermented cod liver oils are perfect. Oh, thank you for somebody putting that up on the Orthomune. And the zinc, again, it depends on what form of zinc you're using. I usually don't like people to take more than 30 milligrams a day of zinc. But having said that, sometimes I will intentionally put people on higher levels if I'm trying to get their iron levels down. 15 milligrams a day is usually what people take just on an average. Okay, everybody is empowered to go create some kind of piece of paper, which is going to be a referral form from you, and you can have your dentist's name on there. I guess it's more appropriate to put his name up top and then say, you as the practitioner, you know, found the following and would like to have whatever ruled out. And then you can specifically, I used to specifically ask for certain labs to be ruled out. I need to know that this patient, what their hemoglobin A1C is. You will be shocked to see that many of your patients will be on drugs that pull out B12, folate, iron, and that they keep complaining of fatigue. And yet nobody's done a good panel of blood work on them to show that they are extremely anemic. Just frank iron anemia. And then when the practitioner looks like, they go, oh my gosh, well, no wonder you've been complaining of fatigue for the last 8 years. Oh, and the 3 prescriptions you're on, they contribute to that. I should have thought about that. It's kind of like giving Lipitor without giving CoQ10. In the very beginning, all of my patients that were on statins, I put them on CoQ10 because that's what I was learning in school. Now, if they give a statin, they know to give CoQ10, but back then they didn't. So I was writing letters to practitioners saying, you know, due to perio issues and the fact that the person is on a statin, I'm asking for permission if our office can suggest that this person take 100 milligrams of CoQ10 because that's what the research is showing for perio. I would always get a very nice letter back. Oh, sure, they can use it. They didn't even know what it was back then. They would just say yes to be polite. And then all of a sudden it was like, wow, this dental office, they knew stuff before it was coming out in the mainstream. Anybody else?
I have a question.
Okay.
Is there a particular brand of the, excuse me, of the hemoglobin chairside test that you like, or
No,
the
I've gotten
A1C?
different ones before. It's just a little gadget that you can use over and over again. It only comes with so many test strips, and then you have to throw it out, and then you'll get another one. What I don't
Okay.
like is when the patient, I sent my mom to go get a 2-pack, and which is $41 at our CVS. Instead, she paid $80 for one test, did a poker finger, and send it in the mail, and it took 10 days to come back. That's
Okay.
one of those Everlywell
Mhm.
tests. And so now I tell my patients, don't get that. Make sure that it has a picture of a gadget that you're actually going to be testing at home and get your results in 5 minutes.
Okay. Okay. Thank you.
It's got a little timer on it. And then
Okay.
your number doesn't show up in there until the timer goes away, and then there's your number.
Okay.
Okay, anybody else?
I would like to mention a case that I recently had in the last 2 weeks with a young man that I've been seeing for many years, and you know, he's always got a little bit of inflammation. He's not maybe that good on his interdental cleaning, but it's always been fairly manageable. When I saw him a week ago, every time I went in the interdental space on the subgingival, the blood just like oozed out, and it formed this thick clotting, like jelly-like clotting. And I'm extremely concerned about it because it was something very different to what I've seen. And I asked him about what medication he's on, and he said he's taking a antidepressant, and he was taking a medication for a fungus in his toenail. And you know, he's been taking the antidepressant for many years, so it's not that it's anything new. And when he walked out, I said, is it maybe the COVID vaccine? And so I couldn't really answer him, yes. And so I'd just like to maybe ask Your opinion on that?
Okay, it somehow cut in and out. I got bits and pieces of that. Someone's on an antidepressant and you notice that his gums are bleeding and that there was a very large clot of blood. Of course, antidepressants will deplete. You can't stay on the same antidepressant because it will deplete some of the neurotransmitters, and all of a sudden you'll make a claim this one's not working anymore, so they'll have to switch it to something else. His psychiatrist should be drawing good labs to look at, like the neutrophils, that they're not too low. There are things that you should be seeing as hygienists that you, again, will be referring to a practitioner. A good example, how many of you have seen a young woman and you say, could you be pregnant? Because in cleaning her teeth, you notice that they're bleeding like they never have before. And then she calls you back and says, holy crap, how did you know that? I just found out I'm pregnant. How did you know that? Just by cleaning my teeth. Because I saw the response of your gums, and that is not normal for you. You don't usually have that much bleeding. So when you see things that are unusual like that, you should be documenting them, but don't let it just stop there. The worst thing that could happen is that you are seeing something and you don't share that with their primary care. Even if it means that you're just sending a letter from the dental office saying, I noticed this. That physician may decide to do clotting studies and find out that they have a hypercoagulation, which is going to put them at higher risk of a stroke. And you found it because you were cleaning their teeth. The worst that could happen is that they end up with mail they have to trash. The best that could happen is they understand there's an office that cares more than any other dental office.
Okay, thank you. Thank you.
Mm-hmm. Okay, well, I was happy to put some of this together. There's a lot that I couldn't put in here in just the short amount of time that I had. You know, things like thiamine deficiencies, which cause facial pain. There's lots of other tweaks of things that go in there. And my hope is that I get it. You're not the person who's going to be reading the labs, but you should have enough knowledge to know what labs to request and start getting comfortable with some of the things that I suggested here and with the offices that are around you and writing that letter. It just means a lot, if nothing else, that somebody is looking at a higher level. Okay.
All right. Thank you so much, Dawn. That was, I'm going to have to go back and listen to this all over again because there was so much fabulous information in there. I so appreciate your time, and we have to bring you back for round 2 because there's just, you know, this we don't get this training, you know, and this is so important as biological dental hygienists, that we understand how the mouth fits in with the rest of the body. You know, we're so much more than just a glorified toothbrush. So I really appreciate your time and effort and energy and knowledge.
Good. You start looking at people's fingernails, look at their feet, look at their ears.
Yeah, it changes everything, you know, when we look beyond the teeth and gums.
Yeah.
So, all right.
Okay, we'll see everybody next month.
Yes, we'll do it again.
Right.
And and then I hope we see all of you in New Orleans in March.
Yes.
So,
and you guys are invited to we have a second Sunday at 6. The IABDM has a hygiene meeting. We're going to be talking about the book, The Dental Diet. We're going to do a book review.
okay. So is it every second Sunday?
Every second Sunday at 6.
At 6.
That's so I could remember it.
Okay. So is that
Central Time?
Central Time.
Yep.
Okay. Excellent. All right.
We're going
Thank
to
you.
develop a core group of hygienists and elevate them through the roof. We're going to create a dental hygiene practitioner.
I love that. I love
Okay.
that. That is my goal as well. So,
See you guys.
okay. All
I
right.
will
Thank
send-
you.
Barbara, I will
Yes.
send this to you so that you could send out this to everybody, okay?
Okay. Well, why don't I have you send it to Kim?
Oh, okay. I could do that.
You have Kim's email address?
I think so.
It's KYM.Smith IAOMT.org.
Okay.
And then I'll have this
will-
recording available and
Yeah, but
And
it'll
then-
make much more sense when you guys see the slides.
Yeah.
I'm sorry we couldn't get that done, but technical
Well,
difficulties, we can arise from that.
I-
No worries.
thank you.
Ah,
I will improve my computer skills.
Nope, nope, not a big deal. Okay,
Well,
bye, everybody.
all right. Thank you, everybody.
Thank you.
Barbara,
Yes.
can you give us the code for the CEU?
Just, you're going to email Kim, KYM.Smith@IAOMT. And then she will send you the CE code, the CE paper. Okay?
Okay.
So just
Thank you.
email Kim, let her know you were here, you heard the whole thing, and you will get that code.
Thank you, everybody.
All right. It was good to see all of you. Thank you. And I'll see you after the holidays. So Merry Christmas, Happy New Year, and Happy Hanukkah, and whatever else. All right,
Can you-
everybody?
Can
Any
you give us
questions before I go?
Ye- one thing, can you give us information as to hooking up with her dental diet the second Sunday? What organization is that through?
That is through the IABDM, the other biological group. The
BDM.
IABDM. Dawn, if you can, are you
Yeah,
still on?
if you will email me, it's Dr. Dawn at drdawn.net. It's just DRDAWN at DRDAWN.net. I will get you the link.
Excellent.
Thank you.
You
All right,
bet.
has everybody got that? We're good? Okay. All right. Thank you all and have a good rest of the weekend.